Hi guys, welcome to Pills and Things, where today we will be talking about the pros and cons of Victoza for type 2 diabetes. I'm assuming that you are probably watching this video because you're taking a Victoza or thinking about starting Victoza or probably know somebody who is taking Victoza. In this video I will go over how Victoza works and then discuss some of the main pros and cons with Victoza. So Victoza is in the GLP-1 agonist drug class, and it works in four main ways. The first way is by increasing how much insulin your pancreas releases if your blood sugar is high. If you watch my previous video on diabetes, remember that your body secretes insulin to lower blood sugar. What's nice here is that Victoza only increases insulin release if your blood sugar is already high, so there's a relatively low risk of low blood sugar episodes. The second way Victoza works is by decreasing how much sugar your liver releases into your bloodstream if your blood sugar is already high. As a side note, if your blood sugar is low, you would want your liver to dump sugar into your bloodstream to bring it back up. And the third way Victoza works is by slowing down how quickly food leaves the stomach, thus slowing down the rate at which sugar gets absorbed into your body. This may also help you feel full faster, thus making you eat less. And the fourth way Victoza works is by working on receptors in the brain to lower your appetite, which can lead to weight loss. Remember, weight loss also helps lower your blood sugar as well. All right, so what are the pros of Victoza? The first is that it lowers A1C by about 1.5% depending on the dose. Remember, A1C is a measure of blood sugar, and a high A1C can increase your risk of heart attacks, strokes, kidney damage, and eye damage, among other things. So bringing the blood sugar down is important to prevent long-term damage to your body. Victoza can also help with weight loss, which is usually about 5 to 7 pounds on average. And just a fun fact, there's another medication called Saxenda that is basically just a higher dose of Victoza and used specifically for weight loss. Victoza also has some heart disease benefits. It has studies showing that it can help prevent heart attacks, strokes, and death from heart disease, which is a pretty big deal for a diabetes medication. The last couple pros I would mention here is that there's no mixing needed, and it can be injected without regard to meals, unlike some other medications in this drug class. As far as the cons, I will mention the ones that I thought were the most important, but this is not an all-inclusive list. The first con is the cost. There's no generic available, so it can be expensive depending on your insurance, if you have insurance. Something else to note is that you will need a separate prescription for pen needles. This is an added cost to account for. One of the most common side effects of Victoza is nausea and vomiting. As I mentioned before, this medication slows down how fast your stomach empties, and if your stomach is full and you continue eating, you will feel nauseous and want to vomit. The nausea and vomiting side effect is why you are started on a low dose and then the dose is increased slowly. And the main takeaway here is don't overeat while on Victoza. Victoza is a once daily injection. If you hate needles, this is something to note. Also, a once daily injection can be a negative thing when compared to some other similar medications like Ozempic or Trulicity that are just injected once per week. Regarding storage, Victoza must be refrigerated until first use, but then it's good at room temperature for 30 days. And as far as some rare but important side effects to note, there is a risk for temporary kidney damage. This is usually related to the nausea and the vomiting that I mentioned previously. If you're vomiting, you can lose a lot of water and easily get dehydrated, which can then hurt your kidneys. There is also a potential risk for pancreatitis. This is rare, but this medication is not recommended if you have a history of pancreatitis. There is also a potential risk for gallstones or gallbladder inflammation as shown in the studies. And lastly, you will see a giant warning on this medication regarding thyroid tumors in rats. This study was in rats, and it is unknown whether this happens in humans, but if you or a family member had thyroid cancer, then this medication would not be recommended for you. Before I finish, I just wanted to make a little disclaimer. This video is for educational use only. This video is accurate to the best of my knowledge as of the date posted, but data is always changing, so always consult your doctor and pharmacist regarding your medications and what would be best to do in your specific situation. So that's it for today. If you learned something today or found value from this video, please gently tap that like button. If you want more easy to understand content on health and medicine, make sure to subscribe to the channel. Thank you for your time and stay healthy. See you next time.